Right. Hello and welcome to today's Periodontology MSc Virtual Open Day. Thanks for everyone who's joining us today. My name is Nancy Gerges. I'm one of the MSc students on the Periodontology course, and I'm going to be chairing this morning. We hope this session addresses any questions you may have about the course. And it will help you gain an insight to what it's really like to study on the Periodontology MSc part-time course. I'm delighted to welcome today's speakers, Professor Yakubu Buti and Dr. Imba Ishkoluyev, who will provide you with a summary of our Periodontology MSc program. And there will be a Q&A session at the end to answer any questions that you may have. The session is being recorded and it will be available on our website today. And now I'm going to introduce our speakers. So first, we're going to start with Prof. Yakubu Buti. He's a professor of periodontology at the UCL Eastman Dental Institute and an honorary consultant in periodontology at UCLH Eastman Dental Hospital. He is a clinical specialist in periodontics and a member of the Royal College of Surgeons of Edinburgh. Yakubu is the program director of the MSc in periodontology at the UCL Eastman Dental Institute. We also have Dr. Imba Ishkoluyev. She's a clinical lecturer in periodontology at UCL. So over to you, Yakubu.
Good morning, everyone. Thank you, Nancy, for the introduction. We're going to discuss today, I hope I'll give you an overview of the program of this MSc distance learning. And as Nancy was saying, we'll have some time for any questions you might have, and I'll try to answer as much as possible. So first of all, again, Nancy's introduced myself as a program director, introduced Imba, Dr. Ishkoluyev, as a lecturer and my deputy program director. I also would like to introduce you to Marianne, who's not here today. Unfortunately, couldn't join, is on leave at the moment, and is our program administrator. I think the main thing here is that, I mean, there are three people here, but the reality is that, I mean, we are part of a larger unit of periodontology at the Eastman, and as a matter of fact, again, we have many different people that at different time in the program join in the form of sort of a speaker, as a live speaker, or having provided some pre-recorded material that will guide you through the program. So this is a 3 years MSc, 3 years master program. In reality, we should call blended learning. Blended because we have a large component of the program which is online. However, we have a component of the program which is delivered as sort of face-to-face, meaning that we have some contact weeks in the form of what we call residential week, where we concentrate the practical component of the teaching. And then we have, over the 3 years, a number of online sessions that are not pre-recorded, but happen as sort of synchronous live session for different type of activity. And we'll give you some example as we go through the discussion of the program. So what are some of the characteristics? This normally each year run between the start of the academic year, which is the end of September, normally the last week of September, until roughly mid-June, when we have the final year exams. So most of the exams happen at the end of each academic year, although there are some modules that are assessed within the year. So overall, we have, out of the 3 years, we have the possibility to interrupt the study or to exit the study. So in terms of if you complete all the modules of the year one, you can exit the program as a certificate, all the modules of the year 1 and 2 as a diploma, or you can complete as an MSc. So altogether, there are 8 modules that form part of the program for 180 credits, 60 per year. Of course, the distribution of these change a lot between among the different years, because while the year 1 and 2 are similar in terms of structure, the year 3 is a year dedicated to the dissertation. So in this regard, the structure and the module credit distribution is different, as we have one module of 60 credit, which is the project that students need to develop during the year. So a brief overview of the structure. So this is the year 1, the certificate year, that consists of 3 modules. Scientific basis of periodontology, periodontal diagnosis and treatment planning, and non-surgical periodontal therapy. In reality, the distinction between the modules sometimes is more sort of on paper that real, because all these modules are quite sort of in a way talk to each other. Yeah, they are very each component or each block of a module may inform also blocks of other module. So it's a dynamic type of situation, but there are 3 modules, and sort of in terms of learning outcomes, the scientific basis is a more of sort of knowledge-based type of module. So where we learn about the fundamental science of periodontology. Then we have a module which is focused on the sort of initial aspect of approaching a patient with periodontal needs, which is the periodontal diagnosis and treatment planning. As the module name says, here we cover a number of aspects, including clinical assessment, diagnosis with the recent new classification of periodontal disease, and the initial treatment planning aspect. And then the non-surgical periodontal therapy module, where we expand on management of the periodontal patient, so type of delivery of sort of periodontal treatment, reevaluation, and indication, and sort of multidisciplinary element of treatment. So over the first year, there are 2 residential weeks, one run in October, normally mid-end of October. The second one is normally mid-end February. So they run from Monday to Friday, full days. And as we said at the beginning, it's really a concentrate, of practical session in the labs, or working on each other, or some sort of interactive case discussion or literature seminar. So the year 2 instead is the year 2, as probably Nancy can confirm, is very packed year in terms of activities. It's a very busy year, but it cannot be much differently, because it has to cover a number of topics that sort of move from the initial non-surgical management of a patient to understanding the next step of treatment. And that means, as you can see, there is a module on surgical periodontal therapy. So there will cover a number of aspects related on the sort of corrective phase of treatment. There is a module on implants. Again, this master is not a master in implants as such, and because of the structure of the type of program as a blended learning, is mainly to give an understanding of how we approach a patient with, for example, peri-implant disease. What are the initial steps of management? What are the options in terms of non-surgical and surgical treatment? And then we have a couple of modules, which one is really a research-based module, which is evidence-based healthcare. And the idea of this module is to sort of lay down the fundamental understanding of research concept, and to apply this in the year to come, which is the dissertation year. So it's almost like a summary, a short module, but it's a summary of the key aspects that you would like to know before starting a research project. Complicating factors and other oral conditions is a long title for a module. What's this about? So this is a module that wants to cover all those aspects that sort of goes beyond the kind of standard periodontal management of periodontal patients. So incorporate some aspect of complex factors that may complicate the treatment. For example, medical history, medication, or aspect in relation to, for example, oral medicine and some pathology that may be associated or may affect the management of a periodontal patient. But also this module covers element of, for example, how to ensure a good quality of delivery of our clinics, our service in practice, for example, in relation to audit projects where we can sort of familiarize on how we can regularly conduct effective audits in our clinical settings to ensure that we always deliver a good quality service. So the year two have got one residential week, which is in normally in March, and this week cover again very compressed week where we discuss we cover all the main surgical aspects in relation to different surgical techniques. We will go through this a little bit more later. So the year three is a dissertation year. So this, as I said, one module, 60 credits. The original idea was to have one residential week. However, this is now become effectively almost two residential week because it's split. The days are split into two time points. One is normally in September or early October, and the second part is in February. And the reason for that is because we have over the years we found that the running certain type of projects, particularly projects that are based in clinical practice and require data collection, in that view, it's better to have two moments where we gather initial understanding of the project and during the first residential week, and a second part where we implement where we have a discussion about how to, for example, analyze data that comes from a collection that has happened until then. So this sort of split is what we are currently looking at. But of course, every year really depends on the type of project that is going to be run. So this is sort of the overview of the structure over the years. In terms of the actual delivery of the teaching, we have a large variety and different type of activity that run. And I think the advantage in a way of online learning is that you can organize and you have a lot of different way to sort of explore the teaching. So this can be in the form of more classical pre-recorded lecture, where you have a speaker sort of discussing a topic. Other are in the form of case, sort of clinical case that are put on Moodle in advance. Then there is an expectation to go through the case, prepare the case, and then come to, for example, an online session to discuss about this specific case. There are a number of, and we'll see in a minute how we structure the material, but there is, of course, some access to reading list and to, again, another number of different activity that sort of prepare over time the actual module learning. When we designed this program, which is, I would say, still a relatively young program because we started in 2019, the idea was so one of my points was that we can't, with online learning, there's no much point to have sort of all the material put in sort of in an online space and then forget about what's going on. So it's very sort of, it requires a regular engagement, I would say. It is not the type of program where you sort of connect once a month or once every 2 months and you look at what's going on there. You got to engage with regular activity. The pros of that is that we believe that is a better way to learn. Of course, the cons is that require engagement. So often students may be busy in practice, and there are periods where it becomes challenging to keep on top of all these, and we are aware of that. But again, the knowledge gain that you get from this environment, I think, and we believe, is more effective, as I said, than simply putting material there to watch or to explore. So talking about the environment online, so we use Moodle. This is a virtual environment, and Moodle, in terms of how it's organized, so each year you will have access to a dedicated Moodle page, and there are two parts really of it. One is a number of tabs that incorporate sort of general resources. For example, you see on the left, you have sort of in a hub, a space where you have different resources. Other tabs, for example, where you need to do some aspect of mandatory training. We have a couple of forums in the Moodle page. One is the sort of a general forum that you see here in green. That is really a space where everyone can ask a sort of question from every type of things, but mainly related to, I don't know, I'm not too sure about this, I cannot access this, or maybe, I don't know, this link bring me somewhere else, or can you tell me when, what's the plan for the next residential week? So it's sort of a general interactive platform. Then we have a clinical room. The idea of that space is where if you have a clinical question, we try to assist with the answer in terms of clinical case discussion. Then, in terms of the actual content of the program, how it's organized, you can see here on the right, you have a number of tabs, and each tab you can see is got a week number, week 1, 2, 3, 4, etc., etc. So each week essentially is a block of material or topic. So you get your module, and within the module you have, for example, this module organized in a number of 6, 7, 10 weeks. And each week deliver a specific component of teaching. And within, and you can see here, I mean, you see these short acronyms like SBOP, PDTP, or NSPT. These are sort of stay for as scientific basis of periodontology, periodontal diagnosis and treatment planning, and non-surgical periodontal therapy. So you can see that you, over the year, you have 1 week that deal, for example, with one module, and another week with another module. This is not always the case. For example, in the year 2, we have slightly modified that in terms of we have more compacted content for each module. So meaning that we tend to cover the module more in a progressive way. And this was often we done a small or bigger change based on the feedback that we receive from every one of you guys when it comes to the program. But the idea is that, again, apart from the sort of progression, the reality is that each week open on Monday with some content. And the idea is that there is an engagement. So every week with some sort of activity. So I'll give you some examples. So this is, for example, is a week of the module scientific basis of periodontology. This open in term 2 and is, for example, you see the date, the week start on the 8th of January, in this case of this year, and then you will see on the right a number of resources. You have some learning objectives for the week, the material in the form of a reading list, in the form of some pre-recorded lecture, and some sort of formative assessment. So the formative assessment are all those assessments that comes, as I said, very regularly during the year and help you to prepare for the final summative exams. So all these reading lists are online and accessible, so you have access to a sort of selected number of articles, scientific articles that we suggest as a sort of essential one. Of course, as part of a UCL membership, you have access to a much wider database of papers, and so it's really there's the possibility to expand as you wish. So this is an example of one reading list when you find all the resource. This is an example of a clinical forum. For example, here you see a question that comes from one of our students about one case. There is a possibility to upload also clinical photos and x-ray to discuss the case. and we discuss as a group or with the tutor. So alongside the sort of the regular teaching activity, we have an online logbook. So the idea is that every year, alongside again the sort of the online teaching, you are expected to have to record the clinical case in relation to periodontology that you manage on in your clinical settings. So one important point, if you're thinking to apply to this program, and this is an important one, you need to have access to periodontal patient. It doesn't have to be, of course, every day, but we would expect that, let's say, on a regular basis, you can see periodontal patient. Not only because of the logbook, but because otherwise the application of the knowledge that becomes very difficult, of course. And and it's fair to say that we have a number of students already, and I think again we can have some testimonials even today, but a number of students that are already even in due course of the program tailoring more their activity to periodontology, so doing more specific management of periodontal patient, and because there is a large need, I would say, in the sort of the practice community. So you see, this is an online logbook, so all of your cases relatively sort of simple in the sense we don't expect you to spend too much time for each patient or for each appointment. So really the idea is that we record regularly dental appointments, trying with a sort of point and click interface where you can expand if you want, you can add more information if you need, but you just expect it to sort of details what type of treatment have you done, what was the visit for, what was the medical history of the patient, and some kind of general information. So let's dig a little bit more into the different year to see what some example of the activity that we do. So for the year one, what are the key aspects we tend to cover? One is clearly the clinical assessment of a periodontal case. So we learn a bit about how to look at a patient in a little bit in a different way, and all of us do clinical assessment, of course, but how do we examine a patient from the periodontal point of view? How do we look at the tissue? How do we look at the keratinized tissue? How do we look at the appearance of the gums? How do we describe that? How do we present that? So there is a component in relation to that. There is a component in relation to how do we describe and report X-ray in general, but specifically when it comes to periodontal aspects. So looking at and be able to understand the anatomy of the morphology of the bone and the supporting periodontal structure, the periodontal ligament. How do we look into this and how that relates to the treatment planning? We discuss about photography, dental photography, fundamental aspect to improve. Yeah, I always say this, I mean, the best way to improve is to look at and document the case, because you look what you've done and you look what happened afterwards. So we have some dedicated training. This is, again, one example of training that happened in the residential week. There is some component online, but mainly there is some activity during the residential week. More broadly, how to document a case, meaning how to put together a presentation, not only for the purpose of, for example, an exam, which is something that will have to be done during the year, but also for anything really, for potentially presenting your cases to, I don't know, to audience, to conferences, why not, or in form of poster, abstract, or case presentation. How to perform a clinical assessment also directly relate to, for example, looking at some example how we do a periodontal chart, and what is the most effective way and most sort of time-efficient way to do so. This is, again, you will find some videos on Moodle on how we do so. Also, we have a number of videos that describe, for example, the instruments. These are in relation to, so we do some practical, of course, during the residential week, and then we have some associated with the practical, some videos that sort of demonstrate, part of the instrument, for example, or demonstrate instrumentation technique that are relevant to periodontology. Okay. So the other important aspect is the diagnosis. Yeah, so this is something we spend quite some time. Diagnosis in relation to the recent sort of update of the classification, the 2018. And then so we look at the two aspects. One is the sort of European consensus workshop that defined the classification of periodontal disease, but also the application in terms of the British Society of Periodontology, like you see in this case, in terms of how that translates into sort of practice and what are the difference between classification European and sort of British aspect. Prognosis is another important topic, how we define prognosis of periodontal teeth with periodontal involvement. So we have some dedicated session on that. Here, we can see some example of instruments that, so again, I'll show you a brief clip of just the type of video that you might have, you might find. This is, again, without audio, but when we discuss this, we spend a little bit of time talking about the component of the instruments, how do we use that instrument, and following the residential week, we have some videos, short clips that, for example, in this case, demonstrate how you position, in this case, a 1314 Great curette for the debridement of the distal surface of a lower molar. Yeah, so this is the kind of activity that mix with the face-to-face, and again, give you some sort of brief demonstration of that. As part, again, of the residential week, of course, we do the same application on models, and there is some sort of assessment that are also related to that, so to ensure that you capture a little bit the main concept, yeah, of this. We said about presenting clinical case. Again, this is a fundamental aspect. In terms of presenting clinical case, we provide some templates that are a guide, not a rigid document to follow, are a guide. But we also have two forms of activity that we run regularly, which are online clinical case presentation. So there are, in relation to that, as I said, our program is part of the larger unit of periodontology. So the full-time program, students have a regular case presentation, which happen every Thursday at lunchtime. So all the unit, including, of course, the MSc Periodontology, join this kind of session. And these are very relevant in terms of discussion of clinical cases, presentation of clinical cases. On the other side, we have also some dedicated case presentation for the cohort of the MSc that also happen on a Thursday, roughly once a month, and then are more dedicated to and tailored to the actual program. So case presentation, I mean, of course, there is, all I'm saying is that these are live, for example, these are example of live session. However, they are normally recorded. So typically, there is the possibility, if you're not able to attend or you cannot attend all of them, you can go back and look at some of these in your own time. So the overall idea is always that. So all this activity that is live is planned in advance. So to allow to schedule sort of block maybe the clinic for 1, 2, 3 hours on that specific date. However, these are also recorded. So if there is an impossibility to attend, then you can access that. Of course, I always say this. So we tend to limit the live online session to those that are really important, and we feel that by not doing it live, we would lose sort of learning. So the idea is that as much as possible, and precisely because we try to organize this at the beginning, sorry, of each year, there is, we expect to have people to attend, to get the most out of it. However, as I said, we appreciate that, everyone is busy with practice, family, etc. And then some of these might not be possible to attend. These are just some screenshots, some picture taken during residential week. So, as I said, we have practical activity, but we do also have a few key sessions or where we need to present cases, and often doing it live as give you that different engagement. So we have some of these going on. These are some of the pictures that we have taken during one of the recent residential week. You see part of so we have some component of practical that is done on models, but also some component that is done working on each other. And for example, here you see collection of periodontal charting on your left. You see aspect of instrumentation in the form of scaling. And on the right, you see clinical photography, which is, again, done working on each other under supervision, of course. These, again, other screenshots, photos taken during 1 hour residential week in the lab. So these are our labs. They are pretty new, I would say, because the Eastman Dental Institute, for those you know, we used to be located in Gray's Inn Road. Now, since 2020, we have moved to the new facility. So we have the university, which is based on the Rockefeller Building in University Street, very close to Houston, and the hospital, which is just around the corner in Huntley Street. So all these are the new labs that you can see we have at the Rockefeller Building. And you can also see that we tend to record also this session, so during the residential week, because some of the exercise that we do are important to, to be available for review at a later stage. So this is really, to conclude a little bit about the year one, so really is the goal of the year is to cover the management of a periodontal patient from the initial consultation, baseline assessment, through the non-surgical periodontal management, up to the reevaluation of a case, and start a discussion about further option for management. So as part of all this, as we see, we have the key aspect of diagnosis, prognosis, treatment planning, different modalities of treatment, and clearly the practical component of what instrument to use, how to use it, and what are the outcomes that we expect from the treatment that we deliver. So this is something that should refine, the skill or gain really the skill about managing a periodontal patient. When it comes to the second year, as we said, we have here four modules. Each one is 15 credits. And it is a busy year because, as I said, we have to cover a number of aspects that go beyond the initial management of the patient. Now, I always like to put this picture on screen because this is what happened. So when we start the program, the first course was 2019. So you probably remember what hit us all as in terms of the time periods. We have the COVID-19 pandemic starting in 2020, and we were in a situation where all our practical residential week were unable to occur because of the impossibility of having any face-to-face activity. So this is we organize a box of instrument and kits and models, and we ship them all over the place and we managed to deliver the training in an online format. This is me and Tom Dixon was the previous program administrator. So I hope we will never had to go back to that situation, to be honest, because it was you can say that it was a true nightmare from every point of view. But of course, organizing something like this was huge, considering that we have instruments and kits blocked at every possible border in every possible country, I would say. But apart from that, so this is to say that, hopefully it won't happen, but we had some plan B if things goes wrong. So this is the some picture again from the labs. This is preparing our surgical week of the year 2. So this is really every day is essentially a discussion about different surgical technique with a focus on clinical component and a focus on sort of demonstrating and understanding the key aspect of each technique, really. Again, this is sort of the layout. As I said, we tend to record this activity as we go. Again, just some short clip that, just to have an idea of
What about the 6?
what we do.
Around the 6, I think, is like around 9-10 millimeters distal. Yeah. The pocket.
Okay, so what design would you do?
Maintain the paramarginal as well.
Maintain the paramarginal. So tell me what, if I'm doing a paramarginal here, then what do I do at this point? Carry on?
Carry on, and then maybe stop a little bit before.
Okay, so I'll stop here. Okay, so if I do my incision.
Yeah. Stop there. Yeah.
Stop there. Okay.
So yeah, this is just sort of the discussion we're having during one of these practical sessions, and is about sort of trying to understand the key component of planning, but also fundamental, I think, is about understanding the option and the realistic outcome, and to inform our discussion with patient at the reevaluation stage. Okay, so what else? Here we have some other, again, pictures of, so these are, we have some dedicated periodontal models which recreate sort of defect associated to periodontitis. So in this case, you see a combination of recession, pocketing, and calculus deposits around teeth. So we can, so typically the simulation that we do are either on this model or on pig jaws. Of course, each of these got its own value. These periodontal models give you the understanding of the defect better. The pig jaws give you the better sort of tactile sensation management of soft tissues. So when it comes to designing incision or grafting, for example, tissue is a more realistic type of model. Again, these are some pictures that we taken in this case, thinking about mucogingival treatment, so demonstration of how to plan an incision for mucogingival surgery. And again, other picture in relation to how to position the blade, how to perform a partial thickness type of flap for root coverage. Yeah, this is some of the example. Refining interdental papilla, devitalizing papilla, suturing technique in relation to different aspects of periodontal management. Suturing, talking about suturing, this is a fundamental component, again, of the training. So we cover large part of the most important suturing technique that we have in periodontology. Again, I'll just show you a short clip of what we said. We have done the horizontal external, with the same concept. We could do an horizontal internal. So basically, instead of coming out on the same flap like we have done before, we enter. And then because it's internal, if you remember, in this case, we go inside again. So we go on the other flap. Okay, so this is the first part. Then we come back. But this time, because it's horizontal, we move either more distally or more mesially, in this case, more distally. We go in. Okay. Okay, now, okay, I'll stop here. It's mainly to give you an idea. So this is again, and some of these clips, then you can access at a later stage, as we said. Pictures, yeah, this, as we said, we use this quite a lot. You can see here, again, some image taken from exercise done for partial thickness type of flap, creation of trapezoidal flap, vertical releasing incision, etc., etc. We discussed about mucogingival, we discussed about harvesting technique. Again, you can see here some picture taken from the exercise on different techniques of harvesting soft tissue graft from the palate and working then on the graft in case you need to desepithelize the graft. On occasion, we have done some, so this is another sort of short clip from one of our external that sort of demonstrate a little bit of a live discussion we have about the case. So I'm just gonna run quickly.
Did everybody understand that? Or anybody still have questions? Because that's a very important concept and it's actually key in terms of the stability and the healing and the aesthetic outcome. So if anybody didn't have it very clear, we can repeat it again.
Can you repeat it, Eva?
So what Roberto was saying is about the design of the trapezoid, yeah, of the flap for your single incision. So you can either do, as he described, a triangular. So your vertical incisions will end into a triangle, into a very thin line. The other option is going to be when you have like a more trapezoidal. And the differences between the two are going to be where you adapt your papilla at the end of it. Let me see if I can do a small drawing of this, and that may be a bit more clarified.
Thank you.
No problem.
Again, the short clips, yeah, where you can see the creation of a flap for mucogingival therapy. This is some of the activity we do.
Just to remember that when we perform the root decontamination, that normally I do it before to cut the flap. But sometimes I need to redo the root decontamination also after the flap ablation. So pay attention, of course, to do not touch the area, the 1 millimeter area close to the bone crest. Because remember, we use also this area for the reattachment.
Okay, so I'll just give you an idea of that. But again, this is some of the activity I was saying we did during COVID, for example, in remote, to try to sort of get where it was more challenging to have any sort of face-to-face demonstration. Again, this is, I'm just gonna go, I'm aware of times a little bit faster, but again, we had, at times we have some speaker sort of discussing about or demonstrating some surgical technique, particularly this during COVID. So overall, I think has always been, I mean, I always say that, I mean, at least I think for us, but I can see most of the time also from our student, there is, of course, a component of fun when it comes to when it comes to this week, because we get to know each other, we get to have some interesting discussion, and also sometimes we have some nice social events, and then we are trying to organize even more social events. So we have our Nancy here that is taking charge of all this. I'm very glad about that. So moving forward about, again, I was talking about location. This is not secondary, I would say. The Eastman is really in the heart of London. So when a student comes from the residential week, it's especially those that are not based in London, there is a very good opportunity to explore this city that offers everything and more. And again, our university that you see on the top right and the hospital very close to each other and are really in the heart of London, near sort of main roads, Tottenham Court Road, with plenty of, pub, restaurant, whatever you need, and very well connected. So it's really, also from that point of view, I guess, is a very good opportunity. So what do we have here? This is a little bit about the layout of our clinical skill lab. I mean, I'll show you some of the picture. It was the rendering. This rendering is done before, actually. We moved to the labs. These are the first things I saw, basically, before we moving to the Rockefeller building. And that was the sort of layout and plan that now you see. So just to say that we have a very large amount of base for practical training. You see, we get very high number of phantom heads, so to accommodate all the activity that we do. Of course, you get individual screen where you can follow the practical exercise, and then so we stream from the main base where myself or Imba or other tutor are, and then everyone can sort of follow up with that. So this was just to show you this environment there. So what else? Again, I'll show you a brief clip. Some of you might have seen this as part of some of the promotional video. If not, I'll just go through it. So I think this gives you an idea of the environment. And in particular, here you see some of the labs, but you also see the clinical skills. So there are two different spaces in the Rockefeller, one for the clinical lab, one from where we have dental chair, where we do the exercise, working on each other. So I'll just show you this briefly. Again, we have a very sort of fancy troupe all doing all that, but this is actually during a real residential week. So some of these activities, all of this activity was really real. Yeah. So this is some of the session that were focusing on instrumentation technique. So once we have familiarized with the instruments, with sort of some teaching material, then we do some practical on models, and then we move into the lab skills. So this, you see, we have 8 dental chair here. Again, you can see it's pretty new. Everything is still, I would say, still new, considering that it's only a few years that we moved there. So it's very nice. I think a very nice environment where we meet in this space. We have also large screens. Sometimes we do some case discussion there. And what else? Yes, yeah, you can see some other sort of video. This is Imbar teaching one of our current year 2 students. So this is, again, just to give you a flavor of the space where we work. I think we have also some clips in relation to the lab later on. This is me, that seems like I'm sort of praying, but it's still, this is the labs where we're teaching. Okay, so it's with the pictures model, the surgical kit. So we also have, of course, a discussion about instrumentation for surgery, different type of dedicated sort of kit or instruments that we use based on what technique we are planning to do. So this is when it comes to as I said, the residential week is really try to sort of the format is that most of the theoretical knowledge is delivered before the week, and when it comes to the week, we try to tie up all this knowledge and apply into the demonstrate and apply into the real world of this. And again, this is another example of when we perform some flap elevation. So there is a lot of discussion about that and about you know, the good thing is that normally we have a relatively small group, so somewhere between 5 and 10 people per year. So it's generally very close. We try to give a very close supervision when it comes to this practical session. Okay. Food and drinks, yes. Sometimes, often we do a little bit of social event during these weeks. This is one of our group, and they were clearly telling me that I was late to join the event, which are probably, you know, doing between millions of activity that we always do. And these are our students. So this is the different cohorts so far. So we have from 2019. Yeah, this is the first picture really we take with the program, because it was still in the old Eastman Dental Institute, 2019. It was a beautiful place, beautiful courtyard with the beautiful fountains, but very, very, very old inside in terms of facilities. So I think from the point of view, we've missed a little bit of art, but we gain in terms of the actual facilities where we work. Again, that's we can see some picture of the graduation ceremony for our first cohort that started in 2019. And of course, along the years, you can see some of these outside the Rockefeller building. This is the group of Nancy. And then we have other picture at social event. In terms of the team, as I said, it's probably a bit of an old picture now, but this is the team that was part of the academic staff, and is an old picture we took I think it was one of the EFP, European Federation of Periodontology meeting a few years ago now. Just to say that, again, there is a number of people joining our teaching. Some of these are still here, some have left, but it's a really good opportunity to interact also in the sort of wider network of periodontology. This is some picture we taken at some social event for some of the graduation and some of the conference trip that we had. I think one was in Spain. So we, as much as possible, so we try to have some sort of fun when it comes to the end of year or when it comes to some conference. So when possible, we attend conference together as a unit. It's not always possible, not always the case, as again, there's been COVID in between that sort of create some issue in relation to that. But now we are again back to normal, so we tend to do more of this. This again a mixed group. This is also in the old building, which is a mix of Enclin Dent and MSc student. Some of these has also become helping with teaching. For example, one of these in the scrub is Jason, that's been helping us with some of the teaching. What about social media? Again, we try to be good with social media as well. I'm not personally, but we have now an Instagram page, which we are absolutely need to follow, where you can see again some of the event of the activity that we do over time. So please do follow us if you want to have more information about what's going on with our program and more in general with our unit. And with that, I think, yeah, I was quite on time, it's about an hour. So I am happy to open the floor for any questions anyone may have.
Thank you, Jacopo, for this incredibly detailed and informative session, which is actually a brilliant reflection of the course now that I'm on year 3. I can confirm that all what has been said is...
It makes sense. It makes sense,
yeah,
right? Okay.
Yeah, it's a very true representation of what the course is about. And now we are happy to receive questions. So if you can pop the questions in the box below that has the Q&A with a question mark, we are happy to answer any questions. So we don't have any questions at the moment. It seems that you covered everything in good detail.
I might have been too clear there. No question. I just probably, if anyone has got anything to ask, otherwise the main thing, couple of things I may just highlight in terms of the purpose of the program. This is what we define as sort of a tier 2 or level 2 program. So for those who don't know, essentially, when it comes to care, our sort of care of pathway for patient, we have sort of the general dentistry, general dental practitioner as a sort of, we call it as a baseline level. Then we have a sort of a level 2, which is what this program is targeting. And then we have the level 3, which is the specialist. So this program essentially sit in between the general dentist and the specialist. Main reason for that is because of the format of the program, I would say, because it's an online, being an online program, there is, of course, not the component of the day-to-day sort of clinical direct supervision. So it's not as such a program that give you itself access to sort of the specialist list. If I think normally this is one of the questions, so I'll try to answer that. Say that nowadays the pathway to apply to become a specialist for the general dental accountancy has slightly, I would say, changed. So if this the program can be part of a larger portfolio, if you have previous experience of other training, of other form of training, each application the GDC can consider on a separate base. So itself, this program doesn't qualify you to become a specialist. But is designed and thought to be a level 2. So this has been designed following what are the sort of the expected items of the curriculum of a level 2 practitioner, as defined by the Health Education England.
Thank you, Jacopo. I see that we have some questions for Nancy.
Right.
I see.
So the first question is, what has been your favorite thing about the program? Well, a lot of things, actually. I think the best thing about this program is the flexibility to learn alongside working. There was no way for me to join a full-time course and to take a gap from work for that long. And this program has just been perfect for me. I maintained a almost full-time job together with learning. Yes, it can be quite challenging sometimes, with all the learning and assignments and all of that, but generally it is very, very doable. And I think one of the best things is that whatever I learned on the course, I could apply straight away, especially in year one, where you're learning how to speak to patients, how to present the cases, how to build a periodontal case. And I think halfway through year one, I moved from general dentistry to purely focusing on perio, actually. And that's what I'm doing now. I just do 1 day general dentistry and 4 days perio only in practices. And I think this links in with the second question, which is, what is your career background and what are your career plans? Okay, so basically, I qualified quite some time ago. So I qualified in 2000. So I've done a fair share of general dentistry. But I've always had this kind of passion for perio. And every time I looked for a perio course, it was a full-time course. So I couldn't do that. And then I came across the part-time course, and I applied and I joined. And I've started, like I said, now I slowly started focusing more on perio in general practice. And by the end of year one, I've kind of made that model for myself, where I wanted to join different practices doing only perio. And I have to say there is a large demand for that, because a lot of the general practitioners are not actually that interested in perio. So they would love for someone to just come in, do their perio cases, and just move on. So my career now is basically, like I said, doing 1 day in general practice, and the 4 other days of the week I'm doing perio only. Slowly developing my surgical skills, because I don't come from a surgical background. I never liked surgery, to be fair. So I'm taking it a little bit slow when it comes to surgery, but a lot of my colleagues who are on the course, they are doing a lot of surgeries now, and they are quite confident with it. And that's basically what I'm doing. Another thing I would like to add is, I think one of the main things about this course is the flexibility. So the fact that you can exit at any point, or actually take a break at any point, is quite an advantage. And when things get stressful, I have to say this about the tutors on the course: they are very approachable, very sympathetic, and very honest. And I'm not saying this because they're still teaching me, but it's really an honest opinion. They're fun as well. So I remember on our last residential, when we're doing the dissertation now, and it was getting quite stressful with all the statistics and everything, we turned around and we found Jacopo and Imba playing table tennis with my colleagues. So, they understand, and they do understand the stress that we can go through, and they are incredibly supportive. So I hope this answers the question. We also have a question that says, do UCL provide scholarships to distance learning program in dentistry? Are you aware of any scholarships?
Good question. I don't think at present there is anything specific to that. But it would have been good to have our program administrator. But we can please, if you have that kind of specific question, if you don't mind dropping us an email, we can further investigate, because these things are constantly changing. I don't want to give you an answer that is not correct at minutes. Yeah, but I can't think about anything specifically dedicated for that at the moment.
Thank you.
I just want to add to Nancy. So thank you for that. I think I'm glad you had also some fun, and of course, just reiterate that I was the best in playing table tennis, just to make sure that everyone.
We've got video footage of that.
Our video as well. Okay.
Yes, and I think Imbar was winning by far, but let's leave it at that.
Okay. Great. Yes, I think just echoing, I think Nancy gave me the opportunity to mention, so the flexibility is an important thing. And of course, is a real sort of trying to find what fits your needs in terms of learning. The distance learning has got a lot of positive from the point of view, because of course you can keep pretty much working full time. I always say is that in terms of time distribution, the ideal is probably allocate 1.5 to 2 days a week for studying. Again, that can be in the form of something done on the weekend. Of course, everyone has got different circumstances, but I normally suggest 1 day a week which is not a weekend, to be dedicated to this teaching, because if you want to get out most of the teaching and not just to sort of navigate at the surface, that's what I recommend. But say that, as I said, all of the activity then get recorded, so you can organize yourself and you can carry on working. So that's, I guess, is intense, but give you the possibility to do that, which is something that, of course, comparing this with a full-time program, that's a completely different story. Yeah, because full-time program require you to be there at all times, and your private activity becomes pretty zero or limited. There are other pros. So it's always about this thinking about what it fits around your needs in terms of learning and commitment. Is anyone else has other questions or anything unclear about the program structure? Or indeed, Imbar, if there is anything you want to add, or I haven't mentioned or forgotten.
I think you've mentioned most of the things, and what Nancy said is really common for most of our students. I think our program really ideal for dentists that have special interest in perio, and they want to expand their knowledge, and they want to gain more clinical and to improve their clinical skills. However, they cannot, from different reasons, do the full time. So I think that's really the main thing, that our flexibility and support to try to give as much as we can in the limited time. And yeah, I think most of our students agree with you.
Okay. Thank you, Imba. Yes. So I think personally, I think I've covered everything. In terms of practicality, for next academic year, so there's still application, if you are planning to apply, still open until the end of July, where is the closure date. Say that we already starting the interview process probably in the next 2-3 weeks. We'll start with those already applied. Again, we tend to take somewhere between 5 and 10 students per year. So if you are interested, or if you have any specific questions, or that you haven't got the reply now, you feel free to drop myself an email or to Imbar indeed, or I guess if Nancy is happy to answer, if there is anything you want to be sort of have further comments about from a student perspective. I'll put just in case you haven't, I put my email in the chat. So you feel free to drop me an email if you got questions that you want to ask me directly. Sometimes we can also organize, or sometimes we can organize one-to-one meeting before, just to have a chat. Or if you are based in UK, or if not, and you're willing to travel, you can come and see the facility here and get to know sort of face-to-face the staff that is on site.
Jacopo, we have a couple more questions.
Good.
Can we go for PhD after Masters in Periodontology?
If you can, yes, you can go for a PhD, absolutely. Of course, if that is the plan, it's probably a good idea to discuss early on about that, especially because when it comes to the dissertation here, if there is a clear intention to progress into a PhD, then we can see if there is a possibility to tailor a project to to be then continued on a PhD level. So if there is that discussion, again, I'm happy to have a chat separately about that and see what is it. Of course, it's only a step at a time, isn't it? You still need to do a master's and at the end you might have enough, or in fact you might be more excited than you want to do a PhD. But
Let me not comment on that. let's not go there.
But you might need a break.
Now,
And then
yeah. There's another question here. What positions will be available in academia after completion of the course?
Good question. That's a very good question. Right. So in terms of the position, there can be certainly, so let's break it into things. One thing is what is possible, what is currently available. Possibility, there would be possibility, of course, to assist with teaching, for example. I mean, having done an MSc, we are in fact looking at, again, this is a relatively young program, but we are looking at possibility of, having some sort of support from previous students in terms of, for example, delivery of teaching or supervision, etc. At present time, we don't have a dedicated position opening for that, but that doesn't mean that they can open over time. It's very dynamic. So there could be possibility, as I said, not at present, but there could be possibility, for example, to assist with some teaching activity or supervision activity for the program, pending availability of position at this stage from the academic point of view.
All right, thank you, Jacopo. Do we have any more questions? I don't think we do. Anyone would like to add anything? Imba, do you like?
Imba, anything to add? No? No, I don't. Again, I don't think. Again, I don't think. I think I've covered everything that I could think about. But as I said, if there are any specific questions, I'm happy to answer that separately.
I just wanted to add that one of the things I've learned a lot from this course is how to speak to patients. Because I find that a lot of general dentists that I come across, they can't actually explain perio to patients properly. They just say you've got gum disease. And because it's one of those conditions that doesn't actually give you problems, like patients are completely unaware that they probably have gum disease in the background and how detrimental it is and what are the consequences of not having the treatment. I found that I've gained a lot of confidence in speaking to patients and backing it up with evidence. And I think it made a huge difference to the practices where I work, patients' engagement, and how much they've started taking on the treatment just because they understand the condition. And I did not have that before this course. And it's incredible. And it's really good to see when patients get interested and start asking you questions that you can actually answer in depth with percentages and outcomes. And it makes a huge difference. And I know it comes across as really theoretical and stuff, but you can apply, I would say, 90% of what you learn in your everyday life. And I work in, private practices, mixed practices, and it's applicable across all of them. So yeah. And like Jacopo suggested, if you've got any questions specifically from a student perspective, let me know. I'm happy to answer those.
Perfect. Thank you very much, Nancy. Yes, that's very helpful. And again, I think it's a good point. Sometimes, you want to chat with someone that has done or is almost completed the program, really. So it's a different perspective. So that's all from me. Again, thank you everyone really for joining this event. Thank you, Nancy, for being available, especially at last minute. Thank you very much. And thank you, Imba, and for being here, and Kate for coordinating the event. I wish you all a nice rest of the day then.
Thank you. Bye.
Bye-bye.